down here in the corner. So this week, week 6, we're going to look at stress and disease. And last week, week 5, we looked at the physiology of stress and how it works in the body. And so we're still sticking a little bit with that body-based viewpoint in terms of then how can it impact our immune system and the health of the system and the body. So I want you to just think last time you had a cold or any kind of illness that you remember really. Were you under more stress than usual? Can you find any correlation between when you're not when you start not to feel well and the stress you have been under prior to that? And if so, if you do think that you're more likely to get sick when you're stressed, why? What is happening inside the body? How is it that your body isn't able to fight that off as well when you're under stress? And that's what we're going to look at is that so? Can that happen? So just a few stats. According to American Institute of Stress, 43% of all adults suffer adverse health effects due to stress, and 75 to 90% of all visits to primary care physicians are for stress-related complaints or disorders. So we are finding that at least some elements of illness are stress related and related to the systems within the body that manage our stress response and our immunity response and how those two work together. It's estimated that between 75 to 85% of all health related problems are either precipitated by or aggravated by stress. So either the stress has come before and then something has knocked out the immune system somewhat, or the stress during it makes it worse. The term psychoneuroimmunology, which we'll talk about, was coined in the early 1980s to link the fields of psychology, neurology, and immunology, and to better understand the relationship between stress and disease. I think this goes to helping us figure out just how important it is for so many parts of our lives to understand our stress response system and to work with it. So just some definitions here. Disease can be caused by a virus, genetic factors, or environmental conditions. Illness and sickness are the unhealthy state that are caused by the disease. The disease is what's going on. The illness and sickness is how we manifest it. The immune system is the body's defense against those infections. Sick role are something that we can take on when we're not feeling well. People look for support and empathy from others when they're feeling ill. We kind of take on a sick role. We can kind of want help, want people to, feel bad for us sometimes. And maybe not all of you get into that. I know I probably can. Illness behavior is what sick role people do. Or sick role do, people that are taking on that role. They evaluate their symptoms, they seek medical care, and they reach out for support. Now, I think the important one about this is secondary gains are the rewards gained through illness. So is there an upside to not feeling well? We get to rest, we get to have people take care of us maybe, if we have the time for that, which often for many, there really isn't time for the secondary gains. But that might play an impact. We'll talk about it a little later. Why is this not working? I'm having some trouble here. Okay. So we are going to talk just for a few minutes here about research methods for studying the link between the two of these. So the first one we're going to talk about is retrospective research design. So there are studies out there that look for both a correlation between stress and illness and causation. Why does stress impact illness? How is that happening? So a retrospective design asks that we look back. Retrospective. I got a little wind filled up there. Sorry. First, we ask in that kind of design, we ask people to recall their past illnesses and stressors, just like I kind of did for you. In the past, how much stress were you under when you got a cold? We can begin to already see maybe some of the difficulties in this, right? But we ask people to look back and to give some explanations. Then we have to verify it. Are those reports accurate? And how do you know they are? How do you know that people's memories are precise and accurate? Is the memory accurate? Do secondary gains motivate the report? So that's where we hear that secondary gains thing. If people kind of get an upkick from being sick in some way, does it influence how they report being ill? How do you know which came first, the stress or the sickness? So that's that's things that have to be verified in order to really be able to link the two. It is simple, it's certainly the least costly, and it's the quickest. But we can see that it has some potential flaws in the verification part. So a prospective research design is longitudinal, which means it takes place over a long period of time. It's not, and we follow people over time to get answers. It's more costly and complex, but it is stronger, has better quality of data. So we follow a person or people over time. We check their stress levels when they're not sick in the beginning, and that can be kind of taking blood samples, looking at the levels of white blood cells and different things in their system, cortisol, anything like that, that would indicate their stress level and their sick level um, before, and then do that periodically. And then when they are sick, take all those levels again, cortisol levels, um, adrenaline levels, all that kind of stuff, as well as their sick data levels. So you have stress data and you have cold data over time. And then you can just see if there is some sort of correlation. Is there a upkick in the stress levels right before they get sick? Is there an upkick in them while they're sick? How, or is there none? So you kind of get more information. It's not dependent on memory. It's definitely more quantitative, meaning there's actual data taken through physical parameters. So another thing we can look at is correlational studies. So in correlational studies, you take two factors, which can be sort of stress and illness, and then you look at you look at the different variables and create a statistical relationship around them. So, for example, researchers might investigate relationship between stress and illness and see how they correlate. Now, correlational studies are not going to find why. They're not going to give you an answer. And a lot of the things we've just been talking about, and even in the prospective studies might give us a correlation, but not necessarily a causation. So even if you look at something like cancer and marriage, you might say, okay, I want to study, is there any relationship between cancer and marriage? Do people who are married get cancer less often or more often than people who aren't, vice versa, whatever? So I look at all the data that there already is necessarily. I'm not doing experiments, and then I see, does there seem to be a correlation? Can I say, okay, well, people who are married have fewer incidences of cancer, or people who are not married have fewer incidences? Then I can say maybe if they do, one way or another, there might be a correlation, but I have no idea why. There still is not a causation to be found. Pearson's product moment correlations is just the most common coefficient. So if you're looking at these kind of studies, R equals 0, there's no relationship. If you get a 0 statistical data, I am not an expert in these kind of statistical measures, I will be honest with you. But if you get a correlation above 0, it means there is a correlation, but it's a positive, so there is a positive correlation, meaning when you increase one, you increase the other. There's an increase in marriage, an increase in cancer, or an increase in stress, an increase in disease. Or a decrease in one can still, and a decrease in the other can still, still a positive correlation. So if you have less disease, with less stress, you have less disease, it's still a positive correlation. A negative correlation shows up as a negative number, and how large these correlations are farther away from 0. But a negative correlation, an increase in one variable, is a decrease in the other. So it might be like more stress actually equals less illness. That's what it would look like. So it's an inverse relationship. It's not yes yes or no no. It's yes no. If that makes sense. My little clicker isn't working. Okay. Then we have experimental studies. I will hide myself. Oh goodness, I'm sorry. I don't know why I'm having issues with this today. I'll just have to put myself up here because it's not working well. Okay, I'm trying to get back to my last slide. I'm really apologizing for this. Um, Experimental studies, bear with me. If I try to move something, I might go away here. Experimental studies where we do actual experiments. They can show causation at times. So in these studies, we have an independent variable. That's the thing that is added, taken away, changed within the experiment, and controlled by the experimenter. So for example, um, Cellier's experiments manipulated the type and amount of stress that a rat had. Now, I look at this like if I have two different classes and I give one class stress management practices to do, and I'm trying to see do stress management practices influence GPA? So if I was going to do a correlation, I could just look at, well, how many people are doing stress management practices and do they have higher GPAs? If I'm doing an experiment, I can say, okay, on one class, I am going to offer these stress management practices. There's a lot of other things that have to be done in terms of who I'm using here, but in another class, I don't give them any. The independent variable is going to be the practices that I give them. That's the piece of it I control that I'm kind of adding to see if they make any kind of difference to the outcome. The dependent variable is the outcome. So that would be for me, it'd be like GPA. For Cellier, he was measuring the stress response system with various forms of stress. So he was manipulating the various forms of stress, looking at if it impacted the stress response system. I might try to manipulate what kinds of practices are provided and see if it has any influence on GPA within the classroom. The experimental group receives the changes made through the independent variable and results are compared to a control group who does not. So a good experiment can show some kind of causation. Do these things actually create a different outcome? All right, so those are just some ways that people study these types of questions. Now, you've already looked at the life events model of stress and illness. That was something like the social readjustment scale. I'll try to move myself again, but it doesn't seem to be working. I'm sorry. Where it uses life change units to categorize different events, death of a spouse being given the top score of 100. So some of you might have taken that and you're looking at what are the different things I've undergone and does it, and to see how much stress I may have and will it impact my health and well-being. A couple of studies with that, 2,500 naval personnel, those with the highest scores 6 months prior, so they took the social readjustment scale and then had those with the highest scores on that later had 90% more illnesses during their first month of tour. Is there a causation? Can't know, but we do see a correlation there. 88 doctors, when they scored over 300 on that scale, 70% of them reported illnesses the next year. And when score was under 150, they did not. So it looked like those with more stress had more illness, so a positive correlation. Criticisms of the SRSS, the social readjustment scale, did lead to dozens, many other scales such as this being created, trying to find a better way. Some of the problems with any of these stressful life event models, most of them are based on retrospective self-reports. So we talked about that. People have to think back to the past if they were stressed, if they got sick. Some items overlap with illnesses. accident, illness, hospitalization, those are listed as life events that can cause stress. And so those are actually overlapping with illness and kind of um, can confuse the results. Effects of negative affectivity or neuroticism, they influence the response. So when we talk about personality and stress, these terms will come up again. Negative affect is being kind of people who are more pessimistic or have a sort of a more negative demeanor. Neuroticism is something that is a personality trait. People who are more anxious, more worried, can certainly influence responses when they are giving their own interpretation of illness and stress and so forth. These are still very popular, though, even with some of these weaknesses. And then if we look at daily hassles model, that research by Lazarus and colleagues showed that hassles played more of a role in illness than life change events did, or had a more immediate impact. Analysis showed a modestly stronger relationship between hassles and illness, more little bit of a positive correlation. Daily uplift shown to have little impact on health, though. So the not good stuff could increase illness, but the good stuff didn't necessarily give it better health. The model suffers from similar problems as the other. Neuroticism can influence the self-reports. It can be, in the way that retrospective model, people having to give their own interpretation and perception of things going on. Sometimes these models are combined to do studies, however, which might give a fuller picture at times. All right, so I am going to pause here and then we'll continue.